Hi guys, myself Devprasad Lokhande. I am a second year MBBS student at Dr. Ullas Patil Medical College, Jaga. My topic is drug affecting coagulation. There are four subtopics that we cover. First is coagulant, second vitamin K, third local hemostatic, and fourth anticoagulant. The first subtopic is coagulant. These are substances which promote coagulation and indicated in the hemorrhagic state. Fresh whole blood or fresh frozen plasma provide all the factors needed for the coagulation. The second subtopic is vitamin K. It is a fat soluble dietary principle required for the synthesis of the clotting factor. The chemistry of the vitamin K is basic naphthoquinone structure with or without a side chain at the position 3. The dietary sources of the vitamin K are green leafy vegetables such as cabbage, spinach, liver or the cheese. Action of vitamin K is acts as a cofactor at a late stage in synthesis by a liver of conjugation protein prothrombin, that is second, 7, 9 and 10 clotting factor. It metabolizes in the liver by side chain cleavage and glucuronide conjugation. It is excreted by the bile and the urine. Deficiency. The deficiency of vitamin K occurs due to the liver disease, obstructive jaundice, malabsorption, and the long-term antibacterial therapy, which alter the intestinal flora. The most important manifestation is bleeding tendency due to the lowering of the level of prothrombin and the clotting factor in the blood. The only use of vitamin K is prophylaxis and the treatment of the bleeding due to the deficiency of clotting factor. First, dietary deficiency. Second, prolonged use of antibacterial therapy. Third, obstructive jaundice and the malformation syndrome. Liver diseases, which include cirrhosis and the viral hepatitis. All newborn have low level of prothrombin and the clotting factor. 6. Overdose of the oral anticoagulant, example coumarin. Adverse effect. Phenytoin injected intramuscularly or given orally hardly produce any adverse effect. Severe anaphylactic reaction can occur on IV injection or emulsified formulation. The third subtopic is local hemostatic, also called as CP. Local hemostatic, that are the substances used to stop the bleeding from the local and approachable site. They are particularly effective on the oozing surface, example tooth socket. Absorbable material like fibrin, gelatin, foam, oxidized cellulose, can which can be cut and placed in the wound. It provides a meshwork which activate the clotting mechanism and the check bleeding. The fourth subtopic is anticoagulant. These are a drug used to reduce the coagulability of the blood. They are classified in the chart. Anticoagulant mainly classified into two types: the parenteral anticoagulant and the oral anticoagulant. In parenteral anticoagulant, there are also two types: indirect thrombin inhibitor and direct thrombin inhibitor. Indirect thrombin inhibitor have example heparin, low molecular weight heparin, fondaparinux, danaferride. Direct thrombin inhibitor example bivalirudin, ergotroban. In oral anticoagulant, vitamin K antagonist, bicytoxycoumarin, warfarin sodium, acinocumarol, ethyl bicumaro acetate. Direct factor 10A inhibitor, example rivaroxaban, apixaban. Oral direct thrombin inhibitor, dalgevestab, etixylate. First, heparin. Chemistry and occurrence of the heparin. Heparin is a non-uniform mixture of the chain mucopolysaccharide with molecular weight 10,000 to 20,000. It contains polymer of 2 sulfate disaccharide unit, diclocosamine L eduronic acid and diclocosamine D glucuronic acid. It carries strong electronegative charges and strong organic acid present in the body. Heparin is also present in all the tissue containing mast cell. Richest source are lungs and the liver and the intestinal flora. The uses of the heparin: first is anticoagulant, second antiplatelet, 3 lipemic clearing. In anticoagulant, heparin is a powerful intestinally acting anticoagulant, effective in both in vivo and in vitro. Is at indirectly by activating plasma antithrombin 3, the heparin and the antithrombin 3 complex then bind to clotting factor of intrinsic factor and the common pathway, which included activated factor 10, activated factor 2, activated factor 9, activated factor 11, activated factor 12, and activated factor 13, and inactivated but not the activated factor 7, which are operationally used in the extrinsic pathway. The pharmacokinetics: heparin is large, highly ionized molecule, therefore not absorbed orally. Injected IV, acts intravenously. Heparin does not cross the blood-brain barrier or the placenta. The adverse effect of the heparin: bleeding due to the overdose. Heparin induced thrombocytopenia, transient and the reversible alopecia osteoporosis. The contraindication: first, bleeding disorder, severe hypertension, gastric intestinal ulcers, subacute bacterial enteritis, chronic alcoholic, liver cirrhosis, and renal failure. Protamine sulfate is antidote used for the treatment of the heparin overdose. Fondoperazone, it is a indirect thrombin inhibitor. The pentasaccharide with the specific sequence that bind to the antithrombin 3 with high affinity induce an irreversible conformation change to selectivity inactivates factor 10A without binding thrombin. The bioavailability is 100% where injected subcutaneously. Heparin antagonist protein sulfate. It is strongly basic low molecular weight protein which obtained from the fish is given by IV. It neutralizes heparin mg for mg. Direct thrombin inhibitor bivalirudin. Bivalirudin binds directly to the catalytic site as well as the substrate recognition site of thrombin and inhibited is directly circulating and the clot bound thrombin is inhibited. Vit- Vitamin K antagonist. Vitamin K antagonist. As we see in the nearby picture, they inhibit the enzyme vitamin K epoxide reductase and interfere the regeneration of the active hydroquinone from vitamin, which acts as a cofactor for an enzyme gamma glutamate carboxylase that carries out the final step of gamma carboxylating glutamate residue of the prothrombin and the factor 7, 9 and 10. Bis-hydrocoumarin, warfarin sodium, acetocoumarol, ethyl biscumoroacetate are the vitamin K antagonists. Direct factor 10A inhibitor. Rivaroxaban, apixaban are orally active direct thrombin inhibitor. They are available for the treatment of the venous thromboembolism. Oral direct thrombin inhibitor. Digabastan etixylate, it is a product which after oral administration is rapidly hydrolyzed to the dabigatran. This direct thrombin inhibitor, it reversibly blocks the catalytic site of the thrombin and produces a rapid anticoagulant effect. Let's see the MCQ. First, antidote of the heparin overdose. As we know, protamine sulfate is antidote from the heparin overdose. So option 2 is correct. Which of the following is vitamin K dependent factor? We also see that prothrombin, that is clotting factor 2, 7, 9 and 10 are the dependent on the vitamin K. So option 2 is correct. Thank you guys.